Come in.
Hi, doctor.
Hello.
Do you have some time?
Yeah,
Could
sure.
we follow you around for one treatment?
Yeah, sure. Yeah, why not? Sounds
Okay.
good. Yeah.
So we'll see you in a while.
See you soon.
Hi, doctor.
Hello.
Hi.
Konnichiwa.
Konnichiwa.
Hello,
It's been a
desu.
while.
Yeah, so Naoka-san, nice to see you again. Yeah, how can I help you today? What's your concerns?
Okay, today my hormone acne scars are quite noticeable
Okay.
around here.
Understand, yeah.
Yeah, so I would like to, get rid of these
Okay.
if possible.
But let's say all these pigmentation or the shimmy from your nikibi or your acne, I think it might be a little bit better to do the pico laser. So today, we'll do a very similar treatment. We'll get you to go over to one room first, whereby we'll do the long pulse laser. That will help with all your redness and maybe a little bit just to help with the pores before we send you over to another room whereby we use a pico laser. So we have two different pico lasers.
Okay.
That sound good?
Yes.
Okay, alright, so what you're going to do is you're going to take a picture and after that we'll get started.
はい、お願いします。
Yeah, show us. Let me check. Okay, great. Let's put the main cream. Yeah.
Doctor, let's start the next patient.
Oh, okay. All right. Thanks. Okay, we'll start. We'll now Haji Marshall. So this is the long pulse laser, and it's good for kekang or veins or capillaries, and it's good for nikibi or pimples. It's good for keana or your pores. So why not, right? So first we'll use this on your akami or your nikibiato,
Right.
and then after that we'll change and then we'll do it for your whole face.
Right.
So don't worry, there's no downtime. Yeah. So and I think it'll be nice. Shall we start?
Okay. はい、
Yeah.
お願いします。
So we also have a blower that we can attach to the laser so that it's less painful. So, can you feel? It will be a bit like this later on. Okay, please close your eyes. Start the show. どうですか？
全然痛くないです。
いいですね。いや、目を閉じてください。
Doctor, what are you treating currently?
So we are treating the redness of the acne or the pimples. Yeah, so the long pulse laser is good for veins, is good for anything which is red. Yeah, so in this case, Naoka-san is a bit concerned with all the redness she has recently from the acne, or in Japanese it's called nikibi. After that, we will change the applicator and we will use it for the whole face. Such that we get some form of pore reduction, a little bit of oil reduction because she's concerned with her pimples. It's good to treat the pimples and the redness, but it's also good to prevent new pimples from coming out. So this is a good treatment for that. Okay, now we're going to do it for the whole face. So it's a very comfortable treatment, right, Naoka-san? Is it comfortable? Is it?
Yes, yes.
Yeah. So it's
I don't feel anything.
yeah, that's nice. Your face.
Microbial works for what?
So that your pores are not blocked.
Oh.
A lot of times when we have got nikibi, it's because your pores are blocked, and that's why your nikibi comes out. You can have a look, yeah, pore forming. So you're now a bit red, yeah. ちょっと赤みがありますけど、it goes away quite fast. So let's just do a micro peel. Don't worry, there's no downtime at all. Yeah.
How many times do patients have to do this treatment for them to see results?
I think people generally see results after one treatment, but it'll be quite mild. So in general, I think 3 treatments is better. Once a month will be really nice. Yeah. So this is really more of a customized treatment since she's concerned with several different things. Yeah. I think having different lasers helps with being able to customize the treatment to the patient's concern. Yeah. Okay. いいですね. So now we are done with this laser. Your face looks a bit shiny. Can you see that? Yeah. So it's because there's a micro. Yeah. And yeah, let's go on to the pico laser. Okay, so now we have another two lasers here. So this is a pico laser. So this is good for shimmy or pigmentation, and the other one is good for akami or kekam. Yeah. So let's just start. If you want to go deeper, we can use this wavelength. If you want to use a bit less deep, we will use another wavelength. So in order for it to be more tailor-made, we will be using quite a few different wavelengths of machine. So if you go to have a treatment done, I think if you have a lot of lasers, then you can choose what you want, get a good result. Shall we start? Yeah. So now what we're going to do is we are going to treat your shimmy one by one first. Yeah. 塞到shimmy show. Yeah, 呢一對住地腳晒，塞到隻手。
You said that we are going to treat her spots one by one. What kind of spots are we treating now?
She has some sunspots. Most people, if they have pigmentation, it's not just one cause. There are many different types of pigmentation. This is what we call mixed pigmentation in people. A lot of times, if you like to collect Pokemon cards, you don't just choose one type of card. You have got a lot of different types of cards.
Is there a reason why you are choosing this pico laser to start with?
It's not too deep, it's not too superficial, it's not too powerful, it's not too weak, So it's actually fairly easy to use, and especially good for maybe like Naoka-san, who has got quite fair skin. Most of our Japanese patients in Canada, they tend to be quite fair. And this wavelength, which is 755 nanometers, works perfectly well for her. So I'm just using this for her spots. I think when people come and they get treatment done, it's a bit scary, right? Naoka-san, is it scary?
Not really, yeah.
maybe not for Naoka-san, but everybody else is
Yeah. But here,
gets a bit scared. Yeah.
here she put the numbing clean for a long time, so
Yeah.
I don't feel
No problem.
at all.
Yeah. Okay, so we have done spot treatment. You can see it's a little bit red, right? Yeah. So that's a spot treatment, but we don't want it to be too harsh, because when it's too strong, sometimes you can get darkening of the spots immediately after treatment. So nothing too strong. Okay, now we're going for the whole face.
How long does one laser treatment procedure usually take?
Well, it depends. No fixed timing, but most maybe about half an hour. It takes about 15 minutes to numb up the skin, and then maybe another half an hour to do it. So I think people should maybe factor maybe about 1 hour of their time.
Is there anything that patients need to take note after finishing a laser treatment?
I think the most important thing is really just to avoid having too much sun exposure. So now guys, don't forget, no sun, thank you. Yeah.
Okay.
Yeah, because in essence, the skin has a tolerance, so they cannot take too much energy. So if I use a high power for her already, and the sun is very strong, the skin may not be able to take it. So
What about alcohol? Can I drink alcohol after a laser treatment?
it will make the redness worse, but it's in terms of having it being bad, in terms of the effects, I think probably not much. Yeah.
One last question. Is there any areas that you would avoid with using a laser?
No, not really. I mean, I guess if the patient has a tattoo, like very commonly over the eyebrow or the lips, we generally want to avoid, because that would either remove the tattoo or might even change the color of the tattoo. Let's say if the patient has got really sensitive skin, like a lot of redness, like people with rosacea, sometimes we shouldn't turn the pulse so high. As you can see, it's a bit red already, so it can get pretty red. But otherwise, I think it's pretty much suitable for almost everybody, and it works pretty well. It's best for people with large pores, pigmentation, who want really minimal downtime treatment. So I think this is what I recommend most of the time. In terms of not doing it for people, I think it's not. I don't really see that many times whereby this is totally not suitable. Yeah. As you ask people, do you not want to have better skin? Do you not want to have less pigmentation? You want to have smaller pores? I think 9.99 out of 10 people will say yes. I want it improved. So I think long answer to your question is it's probably okay for most people. Now guys, we are done. How do you feel? お疲れ様です。お疲れ様でした。Yeah, we have we have made you really, really tired. メイクと他のスキンケアという大丈夫ですけど、you know, those skin care that makes your face a bit red, maybe you can avoid it for maybe a day or two. Yeah.
Okay, thank you, doctors. Thank you so much. Bye bye.